Hi, everyone, and welcome back. We're going to talk about discrete trial training in this video. And so these are the ways that we teach our learners new skills. We're going to start with DTT, which is a kind of huge one. And then I'm going to do kind of an overview of what naturalistic training is and go into a couple different methods of naturalistic training. There are kids who love this, and there are kids that hate this, hate this, hate this. And they prefer that naturalistic method. So it's very important that you kind of start playing with these to determine your learner's preference. If they hate DTT, stop. Don't do it. It's the quickest of everything. But if they hate it, they're just going to be miserable and probably not learn very fast. I had so many kids. When I was younger, my ethics are so different when I was a tech. I had so many kids who would cry, fuss, and make all these behaviors when we said it's all called table time or work time when we did our work, and it's always DTT, and they just hated it. And so if that's your child or that's your learner, there's other ways we can teach them. So why don't we just utilize something they prefer? I had kids who love this so much. They like the structure, they like the sitting, they like all those elements. It's the easiest one to do. They learn the quickest, and it's the easiest for me personally. It's the most structured. If that's your learner and they're into this, utilize it. Enjoy it with them. I would love a kid who loves this. I would do this all day with them. So what is DTT? Discrete trial training. I've had some comments like, well, you said DTT so much, I don't know what that is. It's discrete trial training. It is a very structured teaching method used in ABA, and it breaks our skills down into really small teachable components. With DTT, we have a clear beginning, we have an end. So every trial in DTT has a start and a stop. So it's focusing on one specific skill at the time, and then I call it clear the deck. So when you move to your second trial, you clear your deck. It's like a start over. We have lots of evidence that this works well with people with autism and developmental disorders. It's the quickest method for acquisition. They learn things very quickly with this. Even if a child hates it, it could still be effective. But I would say, why do we have to hate it? There's other things we can do with that child. They'll probably learn at a similar speed if they like the other method you're using better. Only utilize this with those kids that seem to really thrive with it. There's 3 components of a trial. So we have the antecedent. Here's, the instruction stimulus, the cue or response. We have the behavior, so the learner's action to respond to what you just said or the antecedent. And then we have a consequence. So we have an outcome that follows the behavior. It's just like our ABCs that I've already taught you. Antecedent, behavior, consequence. And then I consider this a part of it. When you're taught by others, they might not include this, but the inner trial interval, there's a pause before you start your next trial. So to implement this, you need to be prepared. You need all your materials. This goes super fast. So make sure you gather everything you need during the trial, and I'll tell you in this slide what a trial is. You're going to present the antecedent clearly, observe and record the learner's response, and then apply the appropriate consequence. Record the data accurately and prepare for the next trial. An antecedent is any direction given. Then you have the child's response, and then you provide a consequence. A consequence could be working for something, praise, or it's, no, that's not correct, let's try again, or wrong, let's try again. So you're giving them immediate feedback. So an example of this is you have a bunch of cards and you say, touch the bird. The child responds. If they touch the bird, you say, great job. Moving on, and clear your deck and put out more cards to do it again. If they're incorrect, you give them that feedback. Try again, and then you clear your deck, starting a whole new trial. They're wrong. You gave them feedback, a whole new trial. So you put your cards back out and you say, let's touch the bird. And you might provide a prompt this time to make sure they're correct. And then you give them the feedback. That's correct. Next trial, moving on. And so each antecedent response consequence is a trial, and you do it rapidly, multiple. You just keep doing this. And you got to think about it as every time you give them a prompt, it's a learning opportunity for the individual. And so you're within the time frame you have, you're providing the most amount of learning opportunities. And that's why we have rapid acquisition of skills. It can be done with flashcards, with real items, with directions, with touch, with mimicking. There's lots of ways we do, lots of things we utilize this for. But typically, you can't start this until you can have the learner sit at a table and be calm. A lot of times that will be the first thing. So it's like, sit still, and we'll wait a couple seconds. We'll have them sit still for a few seconds. Good job, you sat still. And then you move on, next trial, sit still, and you make sure that they can sit. I don't think we should start with that. I think you should try to start with something fun. Even if they're fidgety, you just work through it and keep providing them learning opportunities. Prompting strategies in DTT, so we can give it when they're wrong, you close your trial. Nope, that's not right. Moving on. There's no punishment. It's just verbal feedback. You could call it a reprimand, but you shouldn't be angry or have a loud voice. It should be a pretty calm voice. You wait a second and you start your new trial. When they were wrong previously, the next trial needs a prompt. And really, it should be enough of a prompt that they will not be wrong. So verbal prompts, so you can tell them, gestural, you can make a gesture, modeling prompts, or physical prompts. You can like help them point to it. Model, you can model the skill. We'll get into prompts and I'll go over all prompts at some point soon. With this, you provide them a prompt so they cannot be wrong, like a full physical, have their hand point to the bird. You're correct. Good job. Give them their reinforcer, whatever they're working for. Close your trial's closed. You're waiting. Give them a second with their toy or whatever it is. Take it away. Let's try again. Put the bird back out and go touch bird. You might do a little bit of a physical prompt and they do good job. Move on. Eventually they're touching the bird by themselves. You'll do touch bird over and over again until typically we're looking for 80% correct. The trials are 80% correct without prompting and over 3 times. And then you can say they've mastered touch bird, so we can move on to like touch dog. We're teaching vocab in that. You have cards, you're teaching them vocab. So prompt fading, you want to reduce the prompts, and like you wouldn't say mastery within DTT unless it was without prompts. When they're correct with a prompt, it's not accurate. It's not only accurate when it's correct without a prompt. And you will use some sort of prompt hierarchy. It will depend on the child or the learner and your supervisor. But sometimes we do least to most. So we'd start with really small prompts and get heavier as they're wrong. Or we start with most to least heavy prompts to make sure they're correct and fade them out. And we'll talk about that more later in another video. Reinforcement is a really critical component of this. You have to provide reinforcement when they're correct. The reinforcers are delivered immediately after a correct response, providing positive feedback and motivation for the learner. You're giving the praise and the feedback of you are correct, good job. But you also need to provide them something. You give them the toy they're working for. They get to play with the toy for a little bit, and then you move on to the next trial. Reinforcement will increase the likelihood of the desired behavior, the skills that we're teaching. We have primary reinforcers, things like food, drink, and other consumable items. And then we have the secondary. So we have the praise, the tokens, the tangible rewards. This is really good for token boards because you do reinforce quite a bit. If they're getting things correct, you're constantly reinforcing. And so if you have a token board, that will be like easier to manage than just like letting them have a minute with some toy cars every single time. Immediate delivery reinforcement should be delivered right after the correct response. And I know I said if they're prompted into a correct response, it's not correct until they have no prompt. That's true, but we still give them reinforcement. Even if they're prompted into correctness, they still get reinforcement. Should be tailored to the individual's preference, and the motivation must be effective. A huge part of this is data collection. After every trial, you're going to write down how they did, what happened. We're going to use data sheets to record the responses and monitor trends over time to assess mastery. When you're using DTT, the goals are pretty easy to write. It's like 80% mastery over 3 trials with 2 different therapists. This is how we decide whether we can stop working on touch bird. They got that. Let's move on to other vocabulary words so we can build their vocabulary. You document the prompt use. If any, it's better to understand the learner's response. And so your agency, clinic, school will have data sheets for this. They're all similar in a lot of sense. I'm going to show you some examples here, but they might be specific to your agency. If you see it and you're like, I don't really get what to do here, you need training. You need to ask for supervision and training. So we're in baseline, just seeing whether they know or not. So there's no prompting. When we're in baseline, you don't prompt because you're trying to figure out whether they know it or not. Whether they know it or not dictates whether we write a goal and move into DTT or intervention. When we move into maintenance, they learn 10 things like touch bird, touch car, touch bike, all these vocab words. So they have 10 new vocab words receptively because we're saying touch and they're touching it. They're not saying it. And so what you would do when you move into maintenance is you'd mix them all up. So you'd be like, touch bird, good job. Touch card, good job. Instead, when you're in DTT, most of the time you're just going touch bird, touch bird, touch bird, touch bird. When we intersperse the different things we were teaching to make sure they still know them. So they're trying to learn receptive labels of body parts. And again, I think a lot of times you're like, why am I doing that? Like, why is this important? So receptive labels of body parts is hugely important for everybody to know because like a doctor, even like safety stuff or a nurse, all these things, they have to know, like to be like, my head hurts. They should know it receptively and expressively to say head. Language is difficult, so at least we can get the receptive so they can point to their head if someone says what hurts, and they can go point to their head so the doctor can help them as much as they can. So like if you think about everything should have a really, really important end result. And if it doesn't, ask why, like, why are we teaching this? What is this for? Some people with this kind of training start teaching things just for compliance. Like when you think about it, like, do they really need to know this? Will they utilize this goal later on in their life or something? And if that's the case, maybe ask, why are we working on it? If no one has a good answer, ask, like, do we have to work on this? Like, there's so many things you can work on that do have that social validity, that do have a lot of meaning. But like receptive labels of body parts, hugely, hugely important. I can't tell you how many kids, like we're talking about their health and they can't point to body parts to let us know what's going on. That's why they're teaching this, mainly for health stuff. The SD is touch head and they have to touch their head. So we're in baseline, so we're not going to prompt. You can see they did not circle any of their prompts, but they did 10 trials. So they go touch head the first time the person did it correctly. Beautiful. Great job. You still praise even in baseline. And then second one, they said, okay, let's try again. Touch head. And they did it incorrectly. That's a little negative. And then new trial, touch head. And they didn't do it correctly. Oh, that's not right. Let's try again. Touch head. And they did it correctly. And you can see over here, even though that first one, you're like, oh, they know this. And this is like the difference between just like a tutor, I think, or someone without this specialized training and you. So they do it right the first time. So you'll know in baseline, we never take one data point. We're going to always take multiple data points. One time correct is not mastery. If someone didn't have this training, they might move on, but keep going, make sure. And you can see when we do it 10 times, they're not great. They kind of know, but they don't really know. So we're at 50%. We need to be better than that for body parts. We probably want 80, but you might have someone who wants 100. So we are going to move touch head into DTT, where we'll be prompting, providing reinforcement to train them to always touch their head when someone says touch head. Okay? So that's that data sheet. Here's an empty one. Yours might look like this. You put the stimulus touch head, you put correct, incorrect, no response, and you have 10 trials. Here's another one. This is say name. Okay. Like saying name, saying address, saying your parents' phone number, so important for safety, so important. And so this is something we should really teach. The stimulus is say name, a check would be correct. They did a verbal prompt. It's not completely correct, but you still would say, good job. Now we go say name. They did it correctly again with a verbal prompt. The therapist probably started their name like John. So they probably said John. Say name with a verbal prompt. They got it incorrect. Verbal prompts, they can still get incorrect. Sometimes it's physical. They shouldn't get it. They can get it. But it should be correct most of the time with physical. But with language, we can't physically prompt. It's always going to be verbal or gestural. So say name, and they might have pointed to the learner like, I'm asking you about yourself. So gestural, they got correct. Say name, gestural, they got it correct. Say name, they got it correct. Independent, I is independent. So that was 0 prompting. So that's our first correct trial. Say name, we went back to a verbal prompt, incorrect. So this is not correct. If they are independent, you want to stay independent. I don't know why they went back to a verbal. They should have stayed independent, but they went back to independent and they're correct. So they're successful 80% with prompting, but we would want to get them 80% without prompting. Generalization or maintenance, we use the skills in different settings with different people and different materials. We incorporate varied examples to promote generalization. We schedule periodic reviews, so we want to kind of regularly review previously learned skills to make sure they don't lose them. And then we want to ensure the skills are retained, implement strategies to help the students retain what they have learned. So best practices here is to be consistent, same reinforcement strategies across all settings, be patient and attentive. Again, this is like an observation. Your attention should only be on that person. Again, like assessment, I go into kind of almost a mindfulness with this where you're 100% attending to them and the data. You want to make sure you're collaborating if you're ever having trouble or not fully understanding, and you want to seek feedback and development. Continuously request feedback and pursue professional development opportunities. You want to make sure you're implementing this with those behavior intervention plans, which we'll talk about. Sometimes with DTT, they engage in problem behaviors because it's more difficult. If that's continually happening, again, I just wouldn't use DTT. And then prompt fading. You also need to know how to prompt fade and be good at prompt fading to do this. This DTT is a really structured, systematic approach to teach new skills. Consistency is a key, so adhere to the DTT protocol is crucial, and you want to make sure you're doing data-derived decisions, making decisions on which goals to keep, which goals to move on from through your data. It's a collaborative approach. You want to work with others to make sure you're implementing it correctly and working on the proper goals.